be with you in just a second, okay? I'm just taking a little look at your notes. You've been sent straight through to me by my colleague. Let's just see. So you've had some problems with your ears, okay? Yeah. 2 lots of antibiotics, but there's an abscess, okay, in your ear canal, alright? Let's just check what medications. You've had amoxicillin and flucloxacillin. Are you still on the fluclox? Yeah, okay. Alright, but it's still painful, still inflamed. Okay, I will take a look at it again. I know you've just had it examined by the other doctor, but I will check for you, my lovely. Alright, we'll get this sorted for you. Okay, so you suffer from acne, but you've been having some problems with the skin in your ears, alright. Okay. Is it just the one ear? Yeah? Alright. Okay. Well, lucky for you, I was free today, so I will get that sorted for you today. I think we may need to irrigate the abscess in the ear, okay? But don't worry, I'll make it as comfortable as possible for you. Alright then. Okay. So, just going to get some gloves on here. Have you been feeling generally unwell with this? Yeah, okay. Sometimes antibiotics will clear it up, but then there's other times where it does need some intervention. Okay. But I can do that for you, no problem. Okay. Get these on nice and tight then. Okay. Alright then. Firstly, I'm just going to spray and wipe around your ears, okay? Got this lovely, nice refreshing spray. Just keep nice and still for me, alright? Okay. There we go. Let's just have a gentle wipe around there. Okay. How does that feel? Good. And it's this ear, isn't it, that's painful for you? Yeah, okay. Just like to do a little cleanse. There we go. Okay. Let's do this ear now. Gentle wipe round. Very gentle. Is that okay for you? Good, good, good. Perfect. Okay. Right then. I'm just going to take your temperature if that's okay. I'll just insert this thermometer into your ear. Okay. I'll put it into this one because I don't want to pop it in there if that's really sore. Okay. You just hear a couple of beeps, my lovely, alright. So let's just pop that in there very gently. There we go, well done. Okay. You do have a slight temperature, which is rather indicative of an infection, so that'll be what's going on now with that nasty abscess in the ear. Okay, so I'm going to take a look with the otoscope, alright. So you may have seen one of these before. I'm sure you've just had an examination with one. Okay, so it's got a light inside and I'm just going to gently put it into your ear. I will just need to pull up and back slightly. I'm aware it's going to be uncomfortable on this side. Alright, but just tell me if anything's uncomfortable. Keep still and pop up your hand for me. Okay, my lovely. Alright. I just need to take a look at this closely. Alright. So I'm just going to pull up and back on the ear there. Okay. And just gently insert that otoscope there. There we go. Let's just have a little look. I'm sorry, that's a little bit uncomfortable. I'll be very quick in this ear. Oh yes, okay. I can see that. Yeah, that's really angry. I can't see down your ear canal at all, and that's very, very inflamed. I can see that there's a head on that. It's very filled with pus, so that's got to go. And you'll feel much better once it's gone. Okay, right, I'm just going to withdraw that. There we go. Well done, well done. I know that's uncomfortable. I will take a look down this ear as well. Alright. Same again, I'm just going to pull up and back on the ear there. There we go, and just insert that. A nice look around. Okay. You've got a few blackheads down here, but there's no spots, there's no abscesses or anything like that, no cysts, so that's clear, and the ear canal looks pretty good, so that's fine. I can see your eardrum on this side, so that's another good thing, and that looks normal. Okay, my lovely. Yeah, I'm happy with that. I'll just withdraw. Okay, there we go. Don't really want to do any more poking around with your ears for now, apart from removing what I need to remove. So, you've been getting a lot of pain, yeah? Have you been taking painkillers? Okay, just paracetamol. Alright. Okay, so what I'd like to do is put some really lovely drops down your ears, okay, to numb them up. Alright, I'm going to pop some drops in to also remove any earwax, okay? Yeah, okay. I might as well do that while I'm at it. You've only got a little bit in the one side there, and there's just a little bit on this side, okay, before the abscess, okay? Yeah, I just want to remove that before I do anything. Okay, alright. So, 2 lots of drops. I'll numb you up first, okay. So you're going to get 2 for the price of 1 today. So there's only a little bit of earwax in each ear, normal amounts really, but I just want to remove to keep everything clean and to prevent any further infection. Alright. Okay. So these are the anaesthetic drops, so once these are in, they'll just trickle down and they'll numb the ear canal. Alright. Okay. So just keep nice and still for me, and I'll just pop these in. Okay. Bit more there. There we go. You'll only need those in the one ear because that's your sore ear. Alright. So let's just give that a little massage. Get those anaesthesia drops down there. Okay. That's lovely. Okay. And now I'm going to pop some drops in just to soften the little bit of wax that's there in both ears. It's not deep down your ears. I can't see deep down this one anyway, but it's not deep down in this side, but I won't move it while you're here. Okay, these will start to fizz a little bit, okay, when I pop them in. Don't be alarmed, it won't be unpleasant. Alright, and they won't sting or burn. Okay. Right, let's just do this side first. Okay. Pop a little bit more in there. Okay. I'll let them start fizzing. Just pop a few in here. I like the fizzing sound. Okay, right then, let's pop these in this poorly ear. Okay, very gently. There we go. And they're going to fizz now. Good. Right, so I'm just going to get a couple of tools ready. And I'm just going to gently remove the wax from your ears, okay? I'll just start on this side. I'm just going to hear a few little sort of picking sounds. Alright, keep nice and still for me, thank you. There we go. Right, I'm going to be very gentle in this side, even though this one will be numb. Okay, so just say if anything is uncomfortable, okay? Just get these few little bits out. Okay. Is that okay for you, my lovely? Good, good. Perfect. Okay. There we go. Just going to give a little wipe around just on the outer ear now with a Q-tip, okay? There we go. Okay. That's wonderful. A nice fresh Q-tip for this side. Alright. I'm just going to use this just to give a little soft white round, okay, around the very outer part of the ear, okay. Might tickle a bit, particularly on the other ear where it's not very numb. Okay. Nice this. Okay. It's very soft. Okay, it's just look at this one. There. That's wonderful. Absolutely wonderful. So, I'm going to next syringe the liquid out of that abscess, okay? Alright. You won't feel a thing. If you do, you must say, but I will check the area first before I begin. So are you comfortable with that? Good, okay. Okay then. So what I'm going to do, just preparing the syringe, I'll be just removing the contents of the abscess with the syringe, okay? Just going to get that together. Firstly, I want to check the area, okay, make sure that it is numbed up well enough for you. Sometimes when there's infection, local anaesthesia doesn't work too well due to the acidic nature of the affected area. Okay, but hopefully those drops have worked well for you today. So I'm just going to press around the area with the syringe here, alright, and then we'll make sure that's nice and numb for you. So just tell me if anything hurts. Okay. Okay. Right then. So does that hurt? Does that hurt? There. Okay. No? Oh, that's perfect. That's perfect. Okay then. So keep nice and still for me, my lovely, and let's get you feeling much more comfortable. Okay. Alright. Here we go then. I'm just going to go in now and start to withdraw all that nasty infection from there, okay? Nice and still for me. That's perfect. Nice and steady. Well done. Is that okay for you? Good, okay, well done. You're doing really well. Really, really well. Let's get a different syringe. Just get that together, okay. It's coming out really well. Let's do that there. Okay. Perfect, is that okay for you? Good, good. There we go. I think that's got it. That's got it. Okay. Just going to have a little look with the otoscope. Give you a wipe first. Okay. Gentle wipe. Are you okay there? Good, good. Right, let's have a little look. Let's pop that in there very gently. There we go. Look around. Yeah, that's completely deflated now. It's still going to be a little bit swollen for a while, obviously, but that should go down. And you're on antibiotics as well. So that should finish the rest of that off. Okay. That's wonderful. I can see your eardrum now as well. Okay, I'm going to gently withdraw that now, my lovely. Perfect. Well done. You've done really well. Okay, so let's just update that. Yeah, you can feel less pressure already. That's perfect. Makes me happy. Okay, so I'm just going to give your ear a little spray round again. Okay. Alright. Okay. That's looking good now. Let's just have a little look around the outer ear. Perfect. All right. Now I'm going to be placing a dressing over the ear, okay? That's really just to protect it from any water going down it, okay? Anything that could get down it. Okay, you only need to leave this on for 24 hours and try not to get it wet. Alright. Okay. If you've got any problems, it will feel a little sore once the anaesthesia wears off, okay? If you've got any problems whatsoever, alright, that you feel it's very uncomfortable, you're not feeling well, just call us, okay? We can prescribe more antibiotics, but I want to see what your current course of antibiotics does, okay? Because we don't want to give you too many if you don't need them. Okay, alright. This is a very soft dressing. Just gently undo this. There we go. Right then, let's get this on the ear. Keep nice and still there for me. And let's just gently press that down there. Gently press it over the ear canal. Okay, that's perfect. Well done. Make sure that's stuck there. Wonderful. You're looking good. Okay, so I'll just update this. I'll pop that on. When you take the dressing off, if there is any oozing, just wipe that away. That shouldn't last for too long. Okay. Right, so we'll get an appointment made for you. Alright, for a few days' time, we'll come and check it. Alright, we'd like to have a look at it. Make sure it's all doing well. Obviously, as I said, in the meantime, if there's any problems, you can just call us. Okay? Yeah, I've just sent a note for the receptionist to get you booked in. Alright, but before you go, I need to make sure that you're feeling alright. You're not dizzy in any way? Okay. The anaesthesia should start to wear off in about an hour. Okay. But I recommend that you just take paracetamol. Okay. That should help with any discomfort. Drink plenty of fluids and rest. Okay, for the remainder of the day. Yeah, you got nothing planned, had you? No. Alright. And if you can actually sleep on this side, I know it's very difficult, you know, most people change from side to side at night, but if you could try and sleep on this side just to alleviate any pressure on this ear for the next few days, that would be helpful, particularly tonight anyway. Yeah. Okay, so the receptionist will get that booked in for you, and we'll see you back in a few days' time. Okay? Alright, take care of yourself. Bye-bye. So, it's surgery time. I know you know me. I'm Surgeon Sarah. I spoke to you earlier. How are you feeling? You still okay? Good, good. Because earlier you were saying you felt rather relaxed, which is what I love to hear. Yeah? Okay, well, let me just pop on my gloves, because we have to be working clean. Okay, and you've opted for local anaesthesia today, haven't you? Yes. Which is great because this surgery can easily be performed without the need to put you to sleep. Everything is quicker and your recovery would be quicker too. There's less chance of you feeling poorly afterwards because we're not using so many medications. These are nice and tight. Alright then, so let me just see. So today I'm going to be removing some growths from your ears. Yeah? Okay. You've had these growths a while, haven't you? Yeah, so you'll be glad to see them gone. Okay. Well, firstly, I'd like to clean the ear out, okay, with some special wipes, alright? And I'll take a look inside your ear just to see if everything's okay there, that there's no infections inside your ear, okay? So just keep very, very still for me. Just wipe around there, the whole area. It's tickling, okay. Alright, just get that a nice wipe around because I want it to be nice and clean. So I'll just do your left ear. They do smell nice, don't they? Okay, keep nice and still for me, alright? Just gently wipe wipe around. Just to make sure it's nice and cleaned. There we go. All good. Alright. So I'm going to be using the otoscope and just gently pulling your ear up and back and having just a look around inside your ear canal. Let's have a little look at your eardrum just to make sure there's nothing unusual in there. Okay, and I'll do that on both sides as well. So just keep your head nice and still. Alright. Okay. So just pulling the ear up and back and inserting the otoscope gently. There we go. Just having a good look around the ear canal. looks fine. Absolutely fine. It looks really good. No redness, no wax build-up. And I can see your eardrum clearly, and that looks really, really healthy. Okay, I'm now going to remove the otoscope gently. There we go. You're okay there? Great. Right, just do the same on this side. Alright. Pulling your ear gently up and back and just inserting the otoscope. Okay, and having a good look around there. Inside your ear canal. There's no redness, that's super. No major wax build-up. And your eardrum is normal. Okay. There we go. That's perfect. I'm just going to withdraw the otoscope now. That's super. Okay, so you're doing all right there. Good. Next thing, I just need to remark the area that I'm going to be removing. Okay, with my pen. Just to make sure that the lines are really clear. Okay. Alright. Okay there, and that's good. That tickled too. Good. And just on this side. That's perfect. Okay. Right, let me just have a little check around there now before we start. Okay. Perfect. Okay. So I'm going to have to give you a local anaesthetic. Right. So I'll get that prepared and I'll be back in a second. All right. Okay. So I'm going to be popping a little bit of local anaesthetic into the areas on the outer ear where I'm going to remove your growths. Okay. So you'll feel a little sharp scratch at first. All right. And then it'll go nice and numb, so just keep really still for me. Okay, it's not a big needle. Alright. Okay, nice and still for me. Okay. There we go, there's one. And another. And another. And another. How is that? Good. Okay. Just give that a little wipe on. Alright, and let me just pop and do this side. Okay, nice and still again for me. Okay, you're doing great. Alright. Okay. And there's one. There's two. There we go. There's three. Okay. And just at the front there. There we go. Are you nice and numb? Getting there? Okay. we'll leave that for a couple of minutes. All right. So what I'm actually going to be doing is just making incision into the areas, okay? And then I'm just going to be cutting free the growths. They're not very big, and you've had biopsies, so we know that they're benign, so that's good, okay? And then I shall just suture the area up, okay? And then apply a dressing. Yeah. Have you got any questions for me? Okay. Right, let me just check how numb you are. Alright, okay, can you feel that? Can you feel that? Can you feel that? Can you feel that? Okay, and this side. Can you feel that? That? No. And that. Okay, I think we're all good to go. Okay. So I want you to be really, really still for me now, okay? Are you feeling alright? Nice and calm. Just say if you're not and you need me to stop. Alright. Okay. And if you wish to close your eyes, that's fine too. Okay, so I'm just going to work on your right side first. Okay. Alright. Okay. Let's just go around there and just make a little cut. Okay. Does that feel okay? Good. And another. Okay. Just open that up slightly round here. Okay. Let me know if you feel anything uncomfortable, okay? You're doing really well. Okay. Just got a special mirror. I just want to look. Okay. Okay. It's all looking good. Just a little bit more to do on this side. Keep nice and still, you're doing fabulous. Alright. Okay. Alright. That's got it. Okay. this a nice dab off now. Okay. I'm just going to do a tiny bit of irrigation. Alright. So just keep really, really still for me. This is just to clean the area before I clean up and suture. Okay. Alright. Okie dokie. There we go. Alright. And just a tad more. You ready? Okay. All right. Perfect. Right. Just going to wipe around now. I'm just going to put a couple of sutures into the area. Okay. Nice and still again for me. Alright. Nice and still. Okay, just going in with the first one. You're still nicely numb, aren't you? Good. That's one. And another here. There we go. So, let's have a look at that now. That's looking absolutely fine. So I'm going to pop your dressing on there. Okay. There we go. Alright. These are nice comfy dressings. Just to protect it for a few days. Okay. There. All good. Feeling good? Alright. Well, that's one done. Okay. Right. I'm going to move on and do the left side for you. Alright. Are you ready? Good. Okay. So, just grab the things that I need and I'll get going on this side again. Keep yourself nice and still. You've done a wonderful job so far. And let me know if anything's uncomfortable. Okay? Alright. Just make a little cut. Just in that area there. Okay. Nice, neat cut. Okay. Alright. We got that. We got that. That's looking good. Very good. Okay, so on with a little bit more irrigation for you. Get this nice and cleaned out. Okay. At least this doesn't hurt. You can't feel a thing. Alright. You'll feel a little bit of water maybe in the parts that aren't numb. Okay. Alright. Just get that under your ear. Okay. That's looking good. Right. Alright. Let's get that sutured up. It's not that bad, is it, having this done? No. Let's just get this sutured and then you can go back and have a rest. Okay. Alright. Keep nice and still again for me. That's one. Okay. And here we go again. Okay. That's good. You're doing so well, and we're nearly finished. Right. Let's give this just a little check over. Right, I'm going to pop a dressing on this side for you. Alright, let's pop this on. All done. Okay, inspection time, make sure we're all good. Inspect everything. That looks good. Let's just try this side. Okay. Yeah, I'm happy with that. So the nurse on the ward will give you aftercare. Okay, send you home with some dressings and how to look after it once you get home. Yeah, and I'll see you back in my outpatients in a week's time. Yeah, so you're doing okay? Good. You can go back and get a nice cup of tea now. Yeah. But at least everything's gone, and you know that it's perfectly benign, and there's nothing to worry about. Alright, so I'll see you next week. Yeah, I think we have an appointment for you anyway, don't we? Yeah. You come and see me next week and we'll check on everything. Obviously do call us if there's any problems in the meantime. Alright, well, you've done so well today. Alright, I'll see you next time. Alright, take care.